Good afternoon. I'm Elizabeth Hess. I'm here with Julie Pryde. She's the administrator of the Champaign-Urbana Public Health District. First, a big thank you to Urbana Mayor Diane Marlin, as well as UPTV and Jason Liggett. Thank you for producing this segment today. Good afternoon, Julie.
Good afternoon.
I want to ask you about the most discussed virus-related thing this weekend, which was the masks. We are supposed to wear them at all times. However, I was in a park and we were the only family wearing them. In grocery stores, it's better. What are the rules about wearing masks?
You are supposed to be wearing it if you're out in any place, including stores and pharmacies and essential services where you cannot maintain 6-foot distance. And that means all indoor places. If you're out in the park and you're way away from people, then you can have them off. But if you still need to have it with you, and people can be walking by you, and you would need to have that on. The idea of this, again, is to prevent any of your potential virus, if you're asymptomatic, from getting out. This is especially important when we're talking about employers. So grocery stores, pharmacies, big box stores, anything like that where you're in there shopping. The people that are working in there are essential employees, meaning that in order for you to get your groceries and things like that, they have to be working. So the stores have every right to require you to wear a mask to protect their employees when you go in there, and a lot of them are doing that. It is absolutely unnecessary and ridiculous for people to scream at the people working there that they don't want to wear the mask. That kind of stuff is uncalled for. The people working there don't need that. They're stressed enough. They're being exposed time and time and time and time again, all their shift, day after day. The least we can do is put on a mask while we're in there getting our essential items to protect them.
The numbers of cases in Champaign County have gone up. Is that because the virus is spreading more, or because we're testing more, or both?
Well, there's two things. So number one, we are doing a lot more testing, so we're going to find more cases. Also, so before, when we did contact tracing, what we were doing was just putting the individuals into quarantine without testing them necessarily. So now when we have a positive case and we do the contact tracing, everyone that would like to can be tested to know what their status is. So that's an important part of public health. That's what we tend to do when we have adequate test supply. So we are doing that now. So that's also going to show more cases, and then you contact trace and isolate from those, and it just gets bigger and bigger and bigger until you can contain the spread. The other thing is we're dealing with a couple of outbreaks, case clusters, and so anytime you have that, you're going to see cases rise as well.
Speaking of testing, there are two kinds of tests that we're hearing about. We're hearing about the one that goes up the sinus cavity, and we're hearing about a blood test. What is the difference between those?
Okay, so the one that's called the nasopharyngeal swab that goes up into your nose and your pharynx, that one is testing for the virus. So it is called a real-time PCR test, and that is telling you if you have an infection or not. The other one, the blood test, is an antibody test to tell you if you have been infected with it in the past or not. So they are two different things. They're two important tools for public health for making decisions. The problem with the antibody test right now is we still don't know what it means. So, if you have access to it and you're going to get the test, that's still fine, because the answer will be the same one way or the other. Either you've had it or you haven't had it. But what we don't know right now is, can you get it again? Does infection confer immunity? Can you, we just don't know. But the science will catch up with us. It will. So there are the two tests, but if you want to know if you have COVID right now, you need the real-time PCR test, or what's being done, the drive-through testing. Or if you want to find out if you have had it in the past and recovered from it, then you would need the antibody test. So you can just ask for it one of those ways.
Let's say I've recovered from COVID-19 recently. Come fall, does that mean that I won't get this particular strain again?
We just don't know yet. It's too early it's too early to tell. You know, and again, the science will catch up and let us know if it does confer immunity, or if it confers immunity for a year or 6 months or, you know, lifetime. We don't know. But the deal with the flu tests and why we have to get flu tests every year is because flu viruses, especially the A viruses, influenza A, they mutate very, very rapidly, much more rapidly than the coronaviruses do. So every year, there's a bunch of different flu viruses that are circulating. And if they mutate a little bit, or they change a little bit, they can go past what is in the vaccine. So every year they pick 3 or 4 strains every year, that whatever's circulating in the Southern Hemisphere, they pick those, usually 4 now, and then your flu shot covers those 4. In the past, you know, I don't know, 10 years or so, it's been 2 A's and 2 B's. And H1N1 is one of those. So that is why we have to get a flu shot every year. This year, we are absolutely desperately encouraging everyone who can take a flu shot to get a flu shot. Everyone 6 months and up, get a flu shot, because we cannot have COVID going around and making people sick at the same time we have influenza going around in outbreaks making people sick. It will overwhelm our healthcare system.
That brings me to my next point. The 2 things you've been scared of are overwhelming the healthcare system and having outbreaks in long-term care facilities and nursing homes. We have heard of cases now in nursing homes. You mentioned clusters earlier. Is this considered a cluster yet? When do we consider this dangerous and fearful?
Well, so we had 2 cases, 2 cases, one in each of 2 different nursing homes or 2 different long-term care facilities. And they were isolated cases. We did not find any more spread. We've tested staff, tested the entire long-term care facility, and found no other cases. That is a good thing. And that just tells us that in Champaign County, the long-term care facilities are doing an amazing job with their infection control protocol. So even when we knew we had a case in there, their existing protocol was able to contain it and keep it from spreading. So that's definitely a concern. And the real concern about that is that a lot of the long-term care facilities that have outbreaks have a very high fatality rate, because the people that are in there are already older and sicker than the general population. So we consider an outbreak or a cluster. It starts when you have 2 cases in the same facility or the same location or the same, you know, workplace or whatever. So
now let's talk about the fall for a second, because you've said that pandemics come in waves. The Spanish flu of 1918 came in 3 waves over 10 months. I know you can't predict how bad it will be, but can you predict when we'll have our second wave?
It's certainly not unreasonable to think that it will come back, you know, in the fall at higher rates, but we don't really know. The other thing with flu is that, and why there's so much seasonality, is because a lot of people have immunity to flu to begin with. And so there is a lot of seasonality, and there eventually will be with this coronavirus too, just like there is with the other cold strains of coronavirus. But when you have an immune naive population like we have now, that means every single person in the world can be infected with this. So the virus just goes from person to person to person to person. And it's so contagious that it's likely there won't be much seasonality in this. There could be some, but it's not as likely. And in general, respiratory viruses spread easier in the winter months because of the low humidity in the air. So
speaking of seasonality, many of us suffer from seasonal allergies, and every time I personally get a tickle in my throat, I'm worried. I want to get tested. I think something's wrong with me. What else is going around right now? Is there strep? Is there influenza in the community?
Right now, there doesn't seem to be a lot of influenza in the community. There are, people have all kinds of allergies. You can usually, people that have allergies, normally they kind of know what allergies are like. What you're not going to have is typically you're not going to be feeling as sick with allergies, although they can be, extremely miserable, but that's a lot of runny nose and itchy eyes and things like that. But yeah, anyone with symptoms that are unusual and that, can be a fever, that can be shortness of breath, tight chest, cough, even unexplained just fatigue and lack of smell or taste. Anyone with those symptoms can go in and be tested for this now. If you have a healthcare provider, you can contact your healthcare provider. And if you don't, then you can call our COVID hotline at 239-7877 to get a code to go in and test.
And it does not matter if you have health insurance, it will still be covered, or you can get a test.
That is correct. Yeah.
Okay. About special needs family members, the elderly, a lot of people who have asthma or special needs, maybe an autistic child, can't wear a face mask. They cannot be restricted like that. What do you recommend for those type of high-risk cases?
Again, they're not protecting themselves with that. So what you would want to do is to make sure everyone around them wearing a mask and still continue practicing social distancing. But yeah, there are certainly people who cannot wear masks. If you can, get them to wear something else that they might be willing to wear, like a bandana or something, then great. But again, that's not protecting them. What's protecting them is being away from people who could be spreading the virus to them.
I've heard that we've tested tigers who have tested positive for this. Dogs and cats can both get it.
Yep.
Are we supposed to social distance from our pets? Do we know anything more about this?
Well, when you're sick, you should social distance from your pets, which good luck with that if you have a dog. Cats naturally social distance themselves. But so animals can get different diseases from us, and they can get apparently coronavirus or COVID-19. So, if you're around your pet, it's encouraged that you wear a mask, even if you're in your own home. And if you want to have your dog or whatever up against you or sitting on you or within 6 feet of you, then to protect them, you could wear a mask around them as well. But it does not appear that it appears they're like a dead-end host, meaning that they get it, but it doesn't spread from them. So if they get it, it's not spreading on to people or even to other animals. It's not believed at this time. Again, everything changes with this, as more and more research come out. It's hard with as much stuff as we know about this to realize that this has only been around and known about since, December. It's not even been known about on the earth since the end of December. And research is just ramping up everywhere. So it's always safest if you have a cold or respiratory illness or something like that to wear a mask around your dog. People just don't usually do it.
Here we sit at the beginning of May, and I can breathe a sigh of relief that we're not opening things up. We are supposed to shelter in place until the end of the month. Mm-hmm. After that, I have a little bit of dread and fear of what's going to happen once people are so excited to be done with social distancing. Is that something that instills fear in you? What's going to happen come June 1st?
Well, so again, I think people need to get their heads around the idea that things are not going to go back to how they were prior to coronavirus until after we have a vaccination and herd immunity. Things just can't go back to that because we would absolutely overwhelm our healthcare system. But things are already starting to, a little bit loosening up. Masks in public are going to continue to be a thing. I can't see that not being a thing until we get this under control. People will be able to go back to a lot of different types of jobs with a lot of precautions, but it's not, there's not going to be big events. There shouldn't be big events anyway. Big sporting events, concerts, anything like that. We're just not going to be able to do that because anytime you have crowding like that, you're going to have transmission and you're going to see a massive spike in cases, which can cause a lot of other problems. So yeah, it's something that certain things make me anxious, yes, but we look at the numbers every single day for our area. So our recommendations will be based on what is happening here, what is happening with our healthcare system. We always want to make sure that our hospital beds are we have the capacity to see everyone that needs to be seen. And so far, so good. So this will continue until, whenever the state order continues. And then I look for, unless we start seeing a spike in different parts of the state again, I just don't know what it'll look like. But it's important for people to understand, and this is hard for people to understand, just because there are a ton of cases in Chicago is not dictating how the rest of the state operates. You have to look again at the individual hospital catchment areas. Like, what is your immediate area's ability to handle the number of cases? So if, we had as many as Chicago, anywhere in the state, it would be overwhelmed. If other counties had as many as we have in Champaign, their health care system would be overwhelmed. So some of the better maps to look at to kind of get a sense of how things are going is to look at like the case rates in the different areas. So, there's a lot of maps out there, and people need to know that we're not just looking at one thing. Just because people read about one thing, one type of thing, the testing numbers or the hospitalizations or whatever, we're looking at a lot of data all the time for decision making. So it's not just one thing, and it's important that you take into account your own area. And our community has done a really great job of coming together, helping other people. Wearing the mask when you go out, for the most part, people are doing that. So that's important.
One of the things I've been watching, and I know you have as a public health leader, is what's going to happen in Florida and Georgia and some of the states that opened early. Last Friday, should we look in about 14 days to see if those outbreaks have increased?
Yeah, it's really sad to me to see some of the stuff that I feel like I'm looking into the future, because we know exactly what's going to happen. We're going to start seeing increase in cases. We're going to start seeing a lot of unnecessary death from that. The other thing is the protest. Again, that is not the way to be protesting during a pandemic. If you cannot do it in a way that's safe, you're risking not only your own infection, but other people's infection, and taking it home to your family and friends and coworkers. So, it's just, when we're talking about what we're asking people to do as far as wear a mask into a facility to protect other people's health, that just does not seem to be that big of an ask to me. It just does not seem to be that big of an ask.
So it's not an either or situation. Either we have public health safety, or you have individual liberties and freedom. We have to find a way for both of those to be mutually exclusive.
Right. I mean, that is not an individual liberty or freedom type of thing. If somebody tells me to, my job can tell me to do all kinds of things. And same thing with, when I go into Target, strange thing, they would like me to wear a shirt and shoes when I go in there. I don't throw a fit about that. And that's not even protecting the health and safety of their employees. And that's really what this is about. Every place has the right to have their employees protected. And like at public health, if people come in here, they're going to wear a mask. That's just how it's going to be moving forward. Same thing with the hospital, same things with businesses. It's how it's going to have to be. So you do have a right not to wear a mask, but you do not have a right to come into a business or an agency and risk infecting other people, their employees.
And it is on business owners are the ones, it's on them to figure out the best, safest way for not just the customers, but for their employees as well, correct?
Well, the state order is clear that you're to wear a mask into a place like that if you can tolerate it. So but yes, the businesses have a right to do that at all times. I mean, you see it with all kinds of things. They have a right to do that, especially when it involves the health and safety of their workforce.
Last question before I let you go. Should we be worried about the supply chain? You hear about outbreaks at meat and pork and chicken places, as well as, we have our own craft food with thousands of employees here. Should we worry about the supply chain as outbreaks continue to increase?
No. We have been told that is not going to be an issue. Anytime you would have so many workers that weren't able to work at a facility, that could be a problem. Any type of job. but it would be temporary. It would not be, it would not be a permanent type of thing. It would be temporary until people either recovered or new people were hired if they didn't come back or something. But it's not really a concern. I'm not sure what the deal is with not allowing plants to be closed if they're having outbreaks, because all that's going to do is prolong an outbreak if infection control practices. If you have a 800 people and they're all sick or on the verge of getting sick because they're in close proximity, if you can't do anything to protect them, it's going to have to close anyway, just from the weight of not having enough workers there. So it's always better to try to get in front of everything and prevent it early on. That's always the best practice. It's always much, much easier and less expensive to prevent problems than it is to go in and try to mitigate them after the fact.
I always get my information from your agency, CUPHD, from Facebook, but I've gotten some feedback that not everybody is tuned into social media. Where are the other places that they can find it? Well,
you can go to our website, which is c-uphd.org, or you can call the COVID hotline, which is 239-7877, or you can email us at coronavirus@c-uphd.org, or you can just call us as well, or you can watch this little show on UPTV.
Thank you so much. Julie Pryde, I want to thank Jason Liggett. I had some technical difficulties, but you're a technical whiz. I also want to thank Urbana Mayor Diane Marlin for making this possible. But again, Julie Pryde, thank you so much for everything that you're doing. I know you're working around the clock, you and your staff. Thank you.
Thank you.